Minister, thank you very much for being here again. And Minister, my question is also on fentanyl. And Minister, I come from an area where every day I pass by 2-3 ambulances as you don't need to be told that we've had almost 800 deaths. And Minister, I see you so much in my province. It's a good thing you're not a senator, because you would have residency issues because you're there so much. So I know you are really working hard, and I'm not trying to beat up on you. But I feel impotent as a politician when you see 3 ambulances and, you think of the person, is this person going to make it? What happens to their family? It's a real, and you know this, a real epidemic in my area. I know that you're doing a lot, but what is the whole government approach with you, with justice, with the cabinet? What is your vision? How are we going to get hold of this? And people, when I walk on those streets and people say to me, this is not a big thing when you think about our great country and all the resources we have, and we can't get a handle on it. What do we need to do to stop this crisis?
Minister Philpott.
Thank you for raising this question and bringing us back to the topic of fentanyl and the overdose crisis in general, which, as you say, has hit Western Canada in such a dramatic way. It truly breaks my heart every time I hear about the number of deaths that take place. These are young people's lives cut short in what is essentially a preventable crisis. Our response to this has to be whole of government, whole of society, every level of government. Every Canadian, in fact, has to get on board with this, that well over 2,000 people died of overdoses in Canada last year. The numbers in British Columbia went up by 80% from one year to the next. If we continue to see an escalation like that, it would be simply unacceptable in every way. Our response has to be, as I say, comprehensive in terms of who's involved, but also what happens. And so we've reintroduced, we have turned away from the previous anti-drug strategy that the previous government had put in place, and we have reintroduced a Canadian drugs and substances strategy in which harm reduction has been returned. And that's probably the easiest way to frame what the response needs to look like, because that allows you to look at 4 pillars: prevention, treatment, harm reduction, and law enforcement. It needs to have all of those involved. In the area of prevention, there's a tremendous amount that can be done. I could go on all day about this, but we've brought together, for example, in November, over 30 organizations from across the country that work with their regulatory groups, prescriber groups, that are in researchers and all sorts of others who are looking at how we can address the introduction to opioids from the prescription level. So there's a lot of work that can be done on the prevention side from that. And I've talked about mental health and the effect that both mental illness and also unresolved trauma have. And I think this is something that you all may want to help emphasize, is that people use substances because they are in pain. That pain is sometimes physical pain, but very often it's emotional pain. Very often it's the pain of loneliness and isolation and the lack of opportunity in people's lives, and the fact that people were abused as children, and all kinds of other reasons. And we will not solve this crisis until we acknowledge that those are the roots of the crisis that are deep in society, and it's not just about people over-prescribing medications. So a ton needs to be done in the area of treatment. I've spoken briefly around harm reduction, or on prevention. I've spoken briefly around harm reduction, which you all, I know, are supporting as you move Bill C-37 through the House. We've done a lot of work on naloxone, making sure it's widely available to save lives. But treatment is the other area that I think that the Senate could have a strong role in, and Senator Campbell has already spoken to him, and no doubt you have also discussed this as well, because the response is really going to require recognizing this is a health issue. Addiction is not a crime. Addiction is not a moral failing. Addiction is a health issue, and people need to be treated as if they have a health condition. They need to be treated with compassion, with dignity, with respect. They need to be given appropriate treatment. We need to have access to appropriate treatment resources in the country. So I truly think the Senate will have an important role in this. I look forward to what you can do. And of course, this needs to be done in conjunction with many other jurisdictions as well to be able to get this right. But we can turn this around. I met early this morning with coroners and medical examiners across the country about this. I met with people that are from Stats Canada and High so that we get the data. We are determined to address this in the most rapid and effective way possible.